I'm Dr. Carey Hemmelgarn. Thank you for joining us. We're just starting Module 6, which is going to be on human medications, over-the-counter, and prescription that could cause toxicity in pets. So anti-inflammatory pain medications are a very common item in our household, but they're also unfortunately given to pets sometimes as pain relievers, even though they aren't necessarily supposed to receive these medications. Non-steroidal anti-inflammatory medications are a common toxicity in veterinary medicine. NSAIDs, or non-steroidal anti-inflammatories, are rapidly absorbed in the system and can start to show signs within hours of ingestion. That's why we take them, because they can cause pain relief in a very quick time period, but we can also see them cause toxicity in that same time period. NSAIDs are highly protein bound to albumin, but the unbound fraction is the only active form. They are mainly metabolized in the liver and excreted in the urine.
One action.
Due to high protein binding, they tend to have a low volume of distribution. The main mechanism of action includes inhibition of prostaglandin production. Salicylates inhibit the enzyme COX, which helps in the synthesis of prostaglandins. There are two isoenzymes of COX. There's COX-1 and COX-2. COX-1 is involved in the more physiological processes in our body, which includes renal blood flow, and is mainly found in the stomach, the kidneys, the endothelium, and on our platelets. COX-2 is the inducible form of this enzyme and is responsible for the production of inflammatory mediators. The COX pathway aids in production of prostaglandins, and prostaglandins help with inflammation, the GI mucosal health, and renal blood flow. Unfortunately, the GI tract and the kidneys are the most vulnerable organs to NSAID toxicity. Prostaglandins help with vasodilation to help regulate renal blood flow, and if we inhibit those prostaglandins, this can lead to decreased blood flow to the kidneys, and unfortunately, this ultimately can lead to ischemic injuries in our kidneys. The treatment for NSAID toxicity is very similar for all NSAIDs. The first goal should be early decontamination with inducing emesis and activated charcoal administration. This is again to try to prevent as much absorption as possible. Enterohepatic recirculation is an important aspect of toxicity with NSAIDs, and therefore multiple doses of activated charcoal are recommended. But again, only the first dose should have sorbitol, and the subsequent doses should not have sorbitol. GI ulceration is a possibility, and therefore treatment should include GI protectants such as H2 blockers, cimetidine, famotidine, ranitidine, or a protein pump inhibitor such as omeprazole or pantoprazole. Sucralfate can also be very useful in treating an NSAID toxicity because it can help to coat the stomach and try to prevent gastric ulcerations. Misoprostol, which is a prostaglandin analog, is recommended in many of these cases. Antiemetics is recommended if vomiting or nausea is noted in our patients, and that IV fluids are incredibly helpful in treatment of NSAID toxicity. Patients that have NSAID toxicity should be on IV fluids at very aggressive rates for 48 to 96 hours after ingestion, depending on which particular NSAID they ingested. If the dose is large enough, then hepatic toxicity can be seen, and in those cases, liver protectants, such as with SAMI, are recommended in these patients. If extremely large doses, neurologic signs such as seizures have been noted, and in these cases, anticonvulsants need to be added to the treatment plan, and they may need things like mannitol or hypertonic saline if intracranial hypertension is noted. In cases where there's large ingestions of a highly toxic NSAID and it's very early on post-ingestion, then hemoperfusion or hemodialysis may be something to be recommended, and that's something you could always ask poison control again if that's something that this patient is a candidate, and whether we should discuss this as an option for pets. Kidney and liver values should be checked at presentation and then daily for 3 to 5 days post-ingestion. So now we're going to talk about more particular aspects of different types of NSAIDs. So with ibuprofen, cats are more sensitive to ibuprofen toxicity than dogs, and this is thought to be why they are more sensitive to acetaminophen toxicity, but that cats have reduced glucuronidation ability. With Carprofen, which is our veterinary NSAID, it selectively inhibits COX-2 over COX-1, but at really high doses, it inhibits both COX-1 and COX-2, so that preferential is lost at very high doses. Grapiprant is a non-COX inhibiting and works by blocking the EP4 receptor, which is thought to be the main mediator of pain and inflammation in dogs with arthritis. This is a sulfa drug, so we need to be cautious in patients that have sulfa sensitivities in dogs and different types of breeds. As the rule of thumb, black and tan dogs tend to be more prone to be sulfa drug sensitive, so be cautious in those patients. Acetaminophin is a synthetic non-opioid pain medication that is a derivative of the p-aminophenol family. Compared to NSAIDs, the acetaminophin is a poorly protein bound and has a large volume of distribution. It's metabolized in the liver, and small amounts are metabolized in the kidneys, and it's excreted through the bile. So it sort of uses all of our organs. Acetaminophin is metabolized by glucuronidation and sulfation. If the body is unable to use these pathways, such as in cats, it causes decreased glucuronidation ability, and therefore it causes the toxic metabolite of acetaminophin to accumulate. The toxic metabolite of acetaminophin is called NAPQI, and when that starts to accumulate, that's what causes that toxicity. NAPQI causes red blood cell damage, renal injuries, and the red blood cell damage is thought to be secondary to oxidative injuries, which causes methemoglubinemia and Heinz body formations. Clinical signs of acetaminophen toxicity include tachypnea, dyspnea, cyanosis, blue gums, vomiting, weakness, and particularly in cats, they'll develop face and paw edema and sometimes will rub and scratch at their face. Unfortunately, this is something that can be fatal. Hematuria can be noted in some cases, and methemoglubinemia is something you can diagnose crudely by putting a drop of blood on a paper towel. With methemoglubinemia, that's something that it will turn brown instead of red. So that's a very quick way that you can grossly tell if there's a possibility of that. Coaximetry can be used. If ingestion is recent, then decontamination with emesis and activated charcoal is recommended. If symptomatic, then they should receive oxygen support, N-acetylcysteine administration. Interesting, N-acetylcysteine can bind NAPQI and can help to speed up elimination to prevent it from causing further toxicity. Cimetidine, N-acetylcysteine, and absorbic acid or vitamin C together have been shown to improve prognosis in pets that have gotten into acetaminophen. Cimetidine is an H2 receptor antagonist that inhibits P450, and it reduces the metabolism of acetaminophen to NAPQI. So that's going to be very helpful in treatment of acetaminophen toxicity. Methylene blue injection has also been proposed, but has higher risks than proposed benefits. Another toxicity that we can see that's a human medication is albuterol inhalers. Unfortunately, albuterol inhalers are oddly a common toxicity in dogs. Dogs love to chew on the canisters, and then they can puncture the canisters. When that happens, unfortunately, we can see pretty serious toxicity with it. Albuterol is a beta agonist and has positive ionotropic and chronotropic effects on the heart. So the things that we can see that it causes is arrhythmias, rapid breathing, tremors, and in severe cases, seizures. The initial puncture can cause thermal wounds inside of the mouth and the back of the throat, which there has been a case report of it causing an upper airway obstruction from severe swelling associated with that thermal burn. The more profound signs of toxicity that we see more commonly is severe hypokalemia secondary to the albuterol causing the intracellular movement of potassium. Decontamination isn't really an option because it's an inhaled gas, so the treatment is more of how we need to focus our energies. So the treatment involves IV fluids, potassium supplementation, and very frequent electrolyte monitoring. The treatment of tachycardia or arrhythmias, if they're present, and if seizures are present, then anticonvulsant medications may need to be added. Hypophosphatemia is also something you can see with albuterol toxicity, and it's similar to the same philosophy that it causes intracellular shifting secondary to that albuterol. Antidepressant drug toxicity is a rising toxicity due to the prevalence of this being in our households. The most common antidepressant medications fall into 3 categories. We're going to break those categories down and we're going to talk about differences between them. So the 3 categories of antidepressant medications are going to be our tricyclic antidepressants, or our TCAs, our monoamine oxide inhibitors, or our MOAs, and our selective serotonin reuptake inhibitors, or our SSRIs. Our tricyclic antidepressants act by blocking the reuptake of norepinephrine and serotonin at our neurons. They are rapidly absorbed into the system with a high protein binding. Emesis is recommended if the ingestion has been recent, but if it's greater than 30 minutes ago, it's unlikely to be helpful, and unfortunately, it's most likely already absorbed into the system. Charcoal administration is helpful post-ingestion. The clinical signs you can see with the tricyclic antidepressants are going to be tachycardia, vomiting, mydriasis, hypotension, dyspnea, seizures, coma, and in severe cases, unfortunately, death. The treatment is symptomatic for clinical signs, and IV lipid emulsion has been shown to be helpful in treatment of our tricyclic antidepressant overdoses. The next type of antidepressants are the monoamine oxide inhibitors, and these act by increasing levels of epinephrine, norepinephrine, dopamine, and serotonin in the central nervous system. Clinical signs are hypotension or hypertension, arrhythmias, depression, agitation, hyperesthesia, seizures. We can see respiratory changes and in some cases respiratory failure, coma, and unfortunately death. Signs can be seen within 2 hours of ingestion and can last or not be seen for up to 12 hours after ingestion. Decontamination is recommended with activated charcoal, and treatment is supportive based off of our clinical signs. Again, intralipid emulsion therapy is something that has been useful in treatment of our monoamine oxidase inhibitor toxicities. So serotonin reuptake inhibitors work by inhibiting presynaptic neuronal reuptake of serotonin. They are absorbed rapidly in the system and are highly protein bound. Clinical signs of SSRI toxicity are lethargy, agitation, vomiting, ataxia, tremors, seizures, and tachycardia. Decontamination, if ingestion was recent, is recommended, and activated charcoal to follow that. Treatment is supportive, and intralipids can be helpful in treatment of SSRIs. Serotonin syndrome is a possibility with overdose of serotonin reuptake inhibitors. Clinical signs are similar to toxicity, and treatment is supportive, but cipraheptidine, a serotonin antagonist, has been recommended in treatment. Baclofen is another human medication that can cause toxicity in our pets. So Baclofen is a muscle relaxant that's commonly used in human medicine. Baclofen mimics GABA in the spinal cord and helps to reduce muscle spasms. Baclofen is rapidly absorbed from the GI tract, and peak levels can be seen within 2 to 3 hours post-ingestion. And clinical signs of Baclofen toxicity include vomiting, ataxia, dyspnea, respiratory depression, seizures, and unfortunately respiratory arrest. Decontamination is important as long as the patient isn't showing clinical signs. Activated charcoal is recommended if it can be administered safely. We don't want to do it if we're seeing any signs of neurologic impairment or respiratory failure. IV fluids and lipid therapy is something that can be helpful with Baclofen toxicity, and that if a patient's having significant respiratory signs, including dyspnea, hypoventilation, or we're concerned that they're going to fatigue when trying to breathe, then mechanical ventilation is something that unfortunately some Baclofen pets need. Hemodialysis with mechanical ventilation has been reported to help with very severe cases of Baclofen toxicity and may be needed depending on the dose ingested. ADHD medications is also something that pets can get into. The most common medication is Adderall or amphetamine, dextroamphetamine. Other generic or similar combinations of medications are available. They're all going to cause very similar side effects. These clinical signs can almost be immediate with them, but there's also sustained release formulas. Clinical signs include hyperactivity, hyperthermia, tachycardia, tachypnea, mydriasis, tremors, seizures, coma. Diagnosis can be made by using a urine illicit drug screening, which would show up positive for amphetamines. The treatment is supportive with IV fluids, sedative medications as needed, antiarrhythmic medications, and if seizures are present, then anticonvulsant medications. The prognosis is usually good with very early on treatment, but in severe cases it could be poor. Nicotine toxicity. So nicotine is a routine household product in that exposure to pets is common. The most common exposure is either through nicotine gum, chewing tobacco, or the nicotine vape pens. Unfortunately, dogs like to chew on the vape pens and get exposed to nicotine through that. Clinical signs include hyperactivity, tremors, drooling, vomiting, hypertension, tachycardia, respiratory depression, and unfortunately in large doses, coma or death. Treatment is supportive with IV fluids, antiarrhythmic medications. All of those would be useful in treating a nicotine patient. So illicit drugs are in households, and so recreational drugs can be in households, and unfortunately pets get into them. So we're going to talk about some illicit drugs that pets could potentially get into. Marijuana is by far the most common illicit drug toxicity that's seen through ER clinics. The clinical signs are very quick after ingestion and can last up to 12 hours. These include vomiting, depression, hyperesthesia, mydriasis, bradycardia, and urine dribbling. In massive overdoses, we can see stupor, respiratory depression, tremors, and unfortunately seizures, although that is uncommon unless a very large dose. Decontamination is recommended if it's early and there's no clinical signs. If they're already starting to show neurologic impairment, then emesis should not be induced. And treatment is supportive with IV fluids to speed up the process of metabolism through their body. Antiemetics and lipid therapy has had questionable response in patients. Cocaine is a recreational drug that pets can be exposed to. Cocaine is rapidly absorbed in the system as soon as ingestion. CNS stimulation is the systemic action of the drug, and clinical signs include hyperactivity, restlessness, vomiting, bradycardia, then tachycardia, seizures, hypertension, hyperthermia, and in massive overdoses, death can occur. Hypoglycemia can be seen with cocaine cases. Decontamination if asymptomatic, and activated charcoal if it can be safely administered, but based on the rapid onset of clinical signs, often those are not options. Diagnosis can be made with a urine illicit drug screening test, and treatment is supportive for clinical signs. Amphetamines, the treatment is similar as what we discussed with Adderall or ADHD medications. Opioid medications, so this category includes opium derivative drugs, semi-synthetic drugs, and totally synthetic opioids will all cause similar side effects. The clinical signs of toxicity are going to be hypersalivation, vomiting, depression, bradycardia, hypotension, hypoventilation, and increased urination, defecation, seizures, and coma. Decontamination is recommended if the patient's asymptomatic and the treatment is supportive based off of what clinical signs the pet's showing. Mechanical ventilation, if respiratory depression is profound, may be needed. Naloxone is a reversal agent that can be used if a pet is suspected to have gotten into a large opioid dose, and repeat doses can be administered if needed. Benzodiazepines are another recreational drug. This medication can be prescription or recreational. Clinical signs can include sedation, ataxia, weakness, lethargy, nausea, respiratory depression, bradycardia are all clinical signs we can see. Decontamination is recommended early on if clinical signs are not present, and treatment is supportive, and you can use flumazenil as a reversal agent. So this ends Module 6, which was human over-the-counter and prescription medications that can cause toxicities in pets. Module 7 is going to be on insecticides and molluscicides. Thank you so much for joining us today.